The year was 1918. The world was locked in the grip of a devastating war, but a new enemy was emerging, silent and invisible, yet far more deadly. This enemy was the Spanish flu, a pandemic like no other. It began quietly, almost unnoticed, amidst the chaos of World War I. Its origins remain a mystery, but its impact was swift and brutal. Some believe it started in the trenches of Europe, others in crowded military camps. Wherever it began, it spread rapidly. Facilitated by the movement of troops and refugees, the world was at war, and this made the spread of the flu even faster. Soldiers, exhausted and weakened by battle, were easy targets. They carried the virus with them as they traveled across continents, unknowingly spreading it to civilians. By the autumn of 1918, the Spanish flu had reached every corner of the globe. From the bustling cities of Europe to the remote villages of Asia, no place was spared. The world watched in horror as the death toll mounted. Hospitals overflowed with patients struggling for breath. Doctors and nurses, already stretched thin by the war effort, worked tirelessly, but they were fighting a losing battle. The Spanish flu was a new kind of enemy, one that did not discriminate between soldier and civilian, young or old. It was a threat to humanity itself. The Spanish flu was a particularly virulent strain of influenza, a respiratory illness caused by a virus. It attacked the lungs, causing severe inflammation and pneumonia. What made this flu so terrifying was the speed and ferocity with which it spread. People could be healthy one day and dead the next. The symptoms were unlike anything doctors had seen before. It often began with a sudden onset of fever, chills and headache. Muscles ached unbearably. A cough developed, dry and hacking, and soon the sick struggled to breathe. Their skin turned a bluish hue as their lungs filled with fluid. This was a sign of cyanosis, a lack of oxygen in the blood. In severe cases, the flu led to a condition called hemorrhagic bronchitis, where the lungs filled with blood. Death often followed within hours. The virus spread through the air, carried on droplets released when infected people coughed or sneezed. It could also be spread by touching contaminated surfaces. In crowded conditions like the trenches or military camps, the virus spread like wildfire. Even breathing the same air as an infected person could be deadly. One of the most perplexing aspects of the Spanish flu was its unusual mortality pattern. Unlike seasonal influenza, which typically claimed the very young, the elderly, and those with weakened immune systems, this pandemic disproportionately affected young adults. It was a cruel irony. Those in the prime of their lives with strong immune systems were the most vulnerable. Scientists now believe this was due to a phenomenon known as a cytokine storm. In an attempt to fight off the virus, the immune systems of healthy individuals went into overdrive. This resulted in an overproduction of immune cells and their signaling molecules called cytokines. This overwhelming immune response, rather than fighting the virus, caused massive inflammation and damage to the lungs and other organs. The healthy young adults who should have been most resistant succumbed to the flu's deadliest effects. Entire families were devastated, losing sons and daughters, husbands and wives in the blink of an eye. The loss of so many young adults had a profound impact on societies around the world. It disrupted families, communities, and entire economies. The world was left reeling, grappling with an unprecedented loss of life. In 1918, the world was ill-equipped to deal with a pandemic of this magnitude. Antibiotics, which would later prove effective against bacterial pneumonia, a common complication of the flu, were not yet available. There were no antiviral drugs to combat the virus itself. Doctors relied on basic medical care such as aspirin to reduce fever and pain, and oxygen tents for those struggling to breathe. Public health officials implemented measures that are familiar to us today. Schools and businesses were closed, public gatherings were banned, and people were encouraged to wear masks and practice social distancing. Quarantine measures were put in place and hospitals were overwhelmed with the sick and dying. The Red Cross played a vital role in providing aid and relief. Volunteers distributed food and medical supplies, cared for the sick, and helped bury the dead. Nurses were in high demand, and many women volunteered their services, risking their own lives to care for others. Yet, despite their best efforts, the medical community was overwhelmed. The virus spread faster than they could contain it. Section 5. A grim harvest counting the cost. The Spanish flu pandemic lasted for 2 years, from 1918 to 1919. During that time, it infected an estimated 500 million people worldwide, 1/3 of the global population at the time. The exact death toll remains unknown, but estimates range from 50 million to 100 million people. This staggering number surpasses the combined casualties of World War I, World War II, the Korean War, and the Vietnam War. In India, the flu ravaged the country, killing an estimated 12.5 million people. The pandemic exposed the inadequacies of the healthcare system and exacerbated existing social inequalities. In the United States, an estimated 675,000 people died from the flu, more than all US military deaths in the 20th century. The pandemic had a profound impact on American society, leading to changes in public health policy and a renewed focus on infectious disease control. Section 6. Scars on the soul, wounds on the world. The Spanish flu pandemic left an indelible mark on the world. Beyond the staggering death toll, it inflicted deep psychological and socio-economic wounds. The loss of so many lives in such a short period left societies reeling. Families were torn apart, communities shattered, and economies crippled. The pandemic also exposed and exacerbated existing social inequalities. The poor, living in crowded and unsanitary conditions, were disproportionately affected. Minorities and marginalized groups often lacked access to adequate health care. The psychological toll was immense. Survivors carried the trauma of loss, the fear of recurrence, and the guilt of survival. The world after the Spanish flu was a different place. The pandemic had a profound impact on art, literature, and music, reflecting the anxieties and uncertainties of a generation marked by loss and upheaval. Section 7. In the shadow of death, hope endures. Amidst the devastation and despair, there were also stories of resilience, compassion, and courage. Communities rallied together to care for the sick, bury the dead, and support those who had lost loved ones. Doctors, nurses, and other healthcare workers worked tirelessly, often at great personal risk, to save lives. Volunteers stepped forward to provide essential services, distribute food and supplies, and offer comfort and solace. The pandemic revealed the best of humanity as people from all walks of life came together to face a common enemy. The Spanish flu pandemic also spurred advances in medicine and public health. Scientists raced to understand the virus, develop a vaccine, and improve treatments. The pandemic highlighted the importance of public health infrastructure, disease surveillance, and international cooperation in responding to global health threats. Section 8. A century later, echoes of a pandemic. More than a century has passed since the Spanish flu pandemic, yet its echoes still resonate today. The COVID-19 pandemic, which began in 2019, has brought back memories of that earlier time, reminding us of the devastating impact infectious diseases can have on our world. We have learned much since 1918. Advances in medicine, public health, and technology have equipped us with better tools to detect, track, and respond to outbreaks. We have a deeper understanding of viruses and how they spread, and we have developed vaccines and treatments that were unimaginable a century ago. Yet the COVID-19 pandemic has also exposed vulnerabilities in our global health systems and highlighted the persistent threat posed by emerging infectious diseases. Section 9. The vigil continues, preparedness as our shield. The Spanish flu pandemic serves as a stark reminder of the importance of preparedness. We must invest in robust public health infrastructure, strengthen global health security, and support research and development of new vaccines, treatments, and diagnostic tools. We must also address the underlying social and economic inequalities that can exacerbate the impact of pandemics. The Spanish flu pandemic was a defining moment in human history. It taught us the importance of global cooperation, the power of scientific research, and the need for constant vigilance in the face of emerging health threats. It is our duty to remember the lessons of the past and to work together to create a healthier and more resilient future for all.